right, Dr. Ratna, we would love it if you could introduce yourself a bit and help us understand why, we have asked you to join us for this topic and what strength you bring in as sort of the founder and the person who envisioned IAPG and what it means in the context of India.
Thank you, Mugdha, and thank you for that brief introduction. Hi, everyone. I'm Dr. Ratna, and I'm the co-founder of an organization called PAIR, Patient Academy, or Patient Academy for Innovation and Research. The acronym PAIR stands for that. We are a patient advocacy organization, and as Mugdha referred to IAPG, it's the Indian Alliance of Patient Groups, which is a informal coalition of patients working on various therapy areas or various disease areas and come together on common forums where advocacy and empowerment is concerned. Today, we are going to address the sixth of a series of webinars for a particular project on head and neck cancers. And this is the culmination of the series, or the last one, with the topic Strength in Numbers, Patient Empowerment. Now, very often, patient engagement, patient empowerment, patient advocacy are used as interchangeable terms. And today, what I would like to teach or walk you through is what is patient empowerment and patient advocacy, and why is it important for all of us to gather together to be able to bring the strength that we need to amplify our voice. So this is part of a lesson that we have on our website for Patient Academy, and you may wish to visit that and see. It is a series of YouTube videos with special experts who have worked on various aspects of patient advocacy, including governance, financial management, setting up a patient group, etc. And this is lesson 2, which is patient empowerment and advocacy. So what are the learning objectives for today? It is describing the terms of advocacy and self-advocacy, implement strategies for advocating for yourself or for your patients or your loved ones or your family members, describe the components of what self-advocacy means, assess patient capacity to advocate for himself or herself, support patient empowerment to advocate for themselves, identify self-advocacy tools to support patients as well as yourself if you are a patient who wishes to do patient advocacy, identify strategies to support the patient's ability to advocate for himself or herself and communicate with the medical team, and describe strategies for advocating for quality patient care and optimal patient systems. So what is patient engagement? And as I said, patient engagement, patient advocacy, patient empowerment are all used as interchangeable terms. But we will look at what patient engagement is first before we go to patient empowerment and patient advocacy, because before empowerment and advocacy, we need to be engaged with the system. So patient engagement involves encouraging patients in their own care to help improve health outcomes, drive better patient care, and achieve lower costs. It combines the patient's knowledge, skills, ability, and willingness to manage their own care with communications designed to promote positive behaviors. What are the benefits of patient engagement? It increases patient knowledge and understanding and encourages them to become actively engaged in their own health, well-being, and healthcare choices, and leads to improved care and fewer emergencies or inpatient episodes. By collaborating and engagement with patients in decision-making process, healthcare providers can make better decisions regarding a patient's health, improving the patient-provider relationship and overall patient retention. So what is a patient engagement journey and where does it start? This is a multi-stage process of which the patient interacts with hospital or health system, ranging from early education and awareness to physician interaction to appointment follow-ups and further on. So you can see a small sort of a cartoon where the patient is being examined by a physician, and the lack of communication because the patient is telling the physician, let me know if you want to know why I'm here. So the patient is there, but the physician has started the examination without even communicating with the patient. So what are the phases of patient engagement journey and what do they include? It starts with awareness. So the patient becomes aware that there's something not right with his health. Something is either off, or there is pain, or they are not feeling well. And therefore, they do a self-assessment of the conditions and symptoms, leading to an online research and education, posing questions on social media, etc. Sometimes it could be just peer-to-peer questioning. So somebody in the family asks a question, or you ask your neighbor or somebody in the school or college as to why certain things are not feeling right, and if somebody else has felt the same way. This might lead to advice to visit a healthcare professional, and therefore it leads to screening, or the second stage where you have an initial contact with the health system via maybe a call center, an email, a mobile, a physical visit, and who and the questions of who do I contact, where can I find the right person who can tell me what is wrong with me, how can I ask a proper question? Which center should I go to? Should it be a big hospital or a small one? Should I go to the government setup or a private sector? These are the kind of questions that come to the person's mind when they look for information on where they should go for screening. Once they decide on which hospital to go to and what healthcare provider would be able to answer their questions, it might lead to a series of investigations that would lead to a diagnosis. And the diagnosis would be the assessment of the health condition in a medical facility, for example, a physician's office or hospital, etc. Once there's a confirmed diagnosis, which could be a culmination of lab investigations, maybe an X-ray or radiology, as well as a physical assessment by a healthcare provider, it leads to a treatment choice. And the treatment choice could be on site where the treatment is initiated or a prescription is given, followed by a follow-up care where you are asked to come back after a certain period of taking the medications, physical therapy, or a combination of both. And this could also be augmented by behavioral or lifestyle change and adherence, and changes to reduce readmissions and promote proactive health. So, for example, if you are diagnosed with, say, diabetes, then you might be asked to reduce your sugar intake, make dietary changes, improve your physical well-being, increase your physical activity, and then report back after a certain period of time to see whether the medications, along with your lifestyle changes, have made an improvement in your status of diabetes. And then the last part is ongoing care or proactive health, which means that you will be on maintenance once you have achieved your healthcare goals. And this is in between patient visits, fostering engagement between the patient and physician and enabling the patient to better manage his or her own care. It could also include field level workers or case managers or people from the hospital who keep in touch with you through phone calls. So what are the touch points for engagement? The patient is at the center. It could be primary care, it could be hospitals, it could be labs, it could be diagnostic centers, for example, X-rays or CT scans, etc. It could be a pharmacy, and if the person is not ambulant, it could be home care. Or if it's a vulnerable patient, it could be home care. And the people who are involved in this could be a wide range of healthcare providers, from dietitians, physiotherapists, specialist clinics, dialysis units, nursing homes to actual nursing staff. So what are the patient engagement terminologies? As a passive recipient, where you go to the hospital, you listen to what the doctor tells you and you follow the instructions. In hospitals, to increase retention and for recruiting new patients, might be outreach programs where they go to the community and do screening to be able to identify high-risk patients and include them into their hospital programs. It could be through pharma companies for product development and clinical trials, where people are reached out to for a particular cohort and information is sought to be able to enroll into a trial or to understand whether a product is being received in a positive way. By regulatory agencies for adverse event reporting, feedback, for health technology assessment, and for pricing information. It could be government and policy makers, where inclusion of patient feedback for policy making, etc., or documents and other policy documents are shared with people to understand their perspectives. And patients themselves as active participants, where they themselves decide the topics on which they wish to be involved. So there are 6 roles that patients can take as subject matter experts. And if you see at the bottom of the screen, it is research participant. And the previous slide included the passive role of patients, where several agencies would reach out to them for data, and they would then provide that data. Without really being involved in designing the tools for that data or the subject for discussion. Then they can become insight providers, move on to advisors, reviewers, co-researchers, and the driving force for change. So the first role is as a research participant, and as I said, they could be contributing with DNA, with cells, or other biological material for clinical trials, or information to a database, or feedback to documents, and be passive participants. Role 2 is an insight provider, where they provide generic or specific information referred to a specific or general patient population, and supplies disease-specific information for the use in a clinical trial, behavioral or sociocultural study, for example, modifiable risk factors to non-communicable diseases. Then they move on to the third role, which is advisor, and they become informal patient experts because they know their patient journey very well. They know which medicines work for them. They know what medicines do not give them satisfactory results, and what kind of warning signs to expect in their particular disease area, and when to report to a doctor. So they can give advice to, or is an advisory member of, a clinical research program committee, a clinical board, community boards, etc., for the development of trials, HTA bodies, or technical committees. They participate in workshops and advisory boards, where, applying their expertise as a disease experience expert, they share their perspectives vis-a-vis a specific topic, or contest a hypothesis on what this should look like. From here on, they move on to a reviewer's role, where they review various patient-related content, such as articles, brochures, videos, pictures, or materials related to trials, disease awareness campaigns, or patient support programs. And from being a reviewer, they progress to a co-designer. When they are progressing to a co-designer, they are truly experts, and they translate research results, product brochures, and clinical material into patient-friendly information. They are able to participate in designing survey tools and survey questionnaires to be able to gather information, research protocols, etc. They are able to co-write a scientific article, gather research data, and gather information, and draw conclusions from this data, and lead a focus group discussion for research to be able to come to conclusions on what could be some of the most important areas that the particular research should be focusing on. And the last and the final stage is becoming a driving force, where they own or collaborate as a partner in various projects with other patient organizations or industry, and influence policy making and contributing to policy implementation. So most of the or the basis of patient engagement or patient advocacy is derived from communication. Usually, traditionally, the patient-provider communication is very paternalistic, where the patient is the recipient of information, or is only a passive participant in the communication process. The patient is not at the center, though what happens in a traditional setup is each of those healthcare providers is providing information to the patient and guiding and helping them, but the patient is not being given an opportunity to provide feedback. So as opposed to a question like, This is a medication, you have to take it 2 times a day, and you have to report back if you do not feel comfortable or if there is an adverse reaction. If the communication says, this is the medication I'm giving you, this medication will reduce your blood sugars, this particular medication will control your heart, both of these medications work together to be able to control your diabetes and prevent any future heart attacks. This medication is to be taken in the morning. This medication has to be taken after food or after your lunch. And then go back to the patient and ask, have you understood what I have told you? Can you repeat back what I have just explained to you? Do you have any questions on these two medications? Usually, providers are very, very busy and they do not have the time or the ability to be able to communicate for a long time. Therefore, they simply write a prescription and provide the information as a one-way communication channel. So when you become a patient advocate, first you have to learn what a patient advocate means. A patient advocate is a person who helps the patient work with others who have an effect on the patient's health, including doctors, insurance companies, employers, case managers, lawyers, and every other person in the ecosystem. The patient advocate helps resolve issues about healthcare, medical bills, job discriminations, and a varied amount of work that goes into managing the patient's condition. So it could be navigating a hospital which is very complicated and has several departments, navigating a multidisciplinary team, getting in touch with various doctors who manage the condition, getting in touch with various other healthcare professionals who manage the condition, and bringing all of them together to be able to reach a consensus on how best to manage the condition. So strategies for advocating for your patient or for yourself. First of all, one should know what the patient needs are. So what do I need if I have been diagnosed with cancer? I need my medication, I need my nutrition, I need to know what happens once I take a chemotherapy or a radiotherapy. Are there any side effects? If there are any side effects, how do I manage them? When is it critical for me to report back to the hospital? What are the warning signs and symptoms that I should look out for? And how do I keep in touch with my healthcare provider so that I'm able to communicate if there is an emergency? So to be able to do that, one should be able to help the patient learn more about the medical and treatment options. Usually, when a diagnosis is given, the patient is naive. And in the context of India, the healthcare literacy is very low. So they have no clue about what their condition is and what could be the journey or the life course of that particular condition. What is the natural history of their disease? How does it progress? What kind of treatment options are available? Is the diagnosis perfect, or do we need to do more to augment the diagnosis? Is there a need for a second medical opinion? All these questions do not come to the patient's mind, usually because there is shock once there is a diagnosis. But if you need to advocate for your own condition, you need to learn all these things and ask questions from your care providers to be able to augment your knowledge. We also need to help the patient's family come to an agreement on decisions that need to be made for a loved one. And sometimes one has to find legal assistance, especially if you do not have medical cover or you would like to find the options available to be able to manage your financial situation to be able to cover your medical costs. And then one should also need to determine when to advocate. Advocacy is not appropriate at all times. Sometimes we need to trust the medical system, and especially in case of acute emergencies, one needs to just listen to the medical advice that is being given and follow the advice. Once you are better and you are able to listen and rationalize the choices that have been given to you, you can start to ask questions. And if you find there are gaps, then look for solutions to those gaps and start your advocacy journey. And then last but not the least, you have to balance your assertiveness and your communication skills.
Dr. Ratna, you're on mute.
Yeah, sorry, I had a power cut. So let me try and share it back. Can you see my screen?
No, we can't.
Okay. Hmm.
Dr. Ratna, would you like me to share the presentation instead?
Let me try one more time and see if it works. If it doesn't, then
Yeah. Hi, Ravikant. Yes, we are aware. We are trying to fix it. It's a technical issue. I suppose you can see the screen now.
okay. Can you see the screen now?
Yes, we can. Thank you.
Okay, sorry for that. I just lost power. I'm back now. So I was talking about assertiveness and aggressiveness. Being assertive is being soft, but being firm. Being aggressive means you're not listening to the opposite person. You're just trying to put your point across. And being aggressive does not work. If you're a patient advocate, you need to be assertive. So what would one do if you have to advocate on behalf of a patient or if you need to advocate for yourself? First of all, you need to have a talk with your doctor to let them know that you have a few questions that you want to discuss with them, and you set up an appropriate time. As I said before, doctors are extremely busy and they might not know that you have a lot of questions. So letting them know in advance through their assistant or through a nurse that there are a few questions that you would like to discuss and that you would want time dedicated for that is a good idea. Then working with the internal department. So while you would want to advocate with your doctor, going to the lab, going to the radiology department, talking to the nurse or to the physician assistant and letting them know that you have certain questions would be a good idea because it is possible that many questions might be answered by them. And having those answers would make you better prepared to have a conversation with your doctor. Then you could also speak up at a team meeting where there are like-minded people and questions are being asked about a certain topic. And if there is an opportunity, you could raise your hand and speak. Helping patient access services. So in a hospital setting or in a healthcare setting where there are problems or there are challenges for patients to access services, you could help by raising your voice or asking questions so that the access to those services becomes easier. You could write appeal letters to your policy people, to your bureaucrats, to your ministers, to other people who could uh, provide inputs, for example, insurance agencies, and it could be just one person writing the letter, or it could be several people signing on a letter. So to let them know that there is an area of concern that they would be in a process, in a place to address. And then, last but not the least, speaking with others with similar problems will bring in a lot of joint commitment. And because we are talking about strength in numbers, instead of one person talking about a particular topic, if there are several other people who have same concerns or similar concerns, and all of them join together to raise their voice, there are better chances of being heard. So, what is self advocacy? And I'm talking about this because before we start to create numbers, we have to learn what advocacy means and become an advocate ourselves and then look for others who have similar problems and maybe help them to become advocates so that more and more people join the movement and it becomes a group advocacy which starts from self-advocacy. So self-advocacy is assertiveness and willingness to represent one's own interests when managing a life-threatening disease. And it could not be, may not be life-threatening, it could be a chronic long-term condition as well. So it is the ability to stand up for your own needs and speak for yourself at appropriate forums, raise the right questions, and seek answers. Sorry, let me go back. So what could be some of the outcomes of self-advocacy? It could be improved self-concept. So you understand your condition better, you understand what your touch points are, you understand who in the healthcare system can provide you with answers, who you understand which specialties deal with your condition, you understand what happens when something is not working well and who you should reach out to. And you also understand why it is important that you have those people on your speed dial, for example, so that if there is an emergency, you are able to reach out to them. Then you also have increased control over one's own care because you have all this information. You are able to make decisions faster. You are able to manage emergencies better. And probably your care becomes out of the hospital and is more dedicated towards your home where you're able to take care of yourself. You have a strengthened sense of autonomy because you are not dependent on other people for your healthcare needs. You have improved symptom management because you know your medications better, you know which medication has a side effect, you know which medications have to be taken at what time, and you are able to monitor your medications better. You have improved adherence because you understand which medication gives you better results, what medication makes you feel better, which medication gives you maybe an undesirable effect, and what to do to overcome that particular effect. So, for example, if a medication gives you burning and acidity, you know that you have to take that only after food. And even if that doesn't work, then what to do to improve that particular side effect. Then you have increased satisfaction with care because you know your medications better, you have better control over your condition, you have lesser side effects, you have better control over any effects, etc. So you are more satisfied with your care, and that leads to improved quality of life and decreased healthcare use. So your hospital admissions will decrease, your hospital appointments will decrease, that will reduce your financial dependency on healthcare, and you will have a better quality of life. So what are the basic elements of self-advocacy? First is thoughts and cognition. So you will think, what should I do to make my healthcare better? You will recognize, what are the elements that are required to make your healthcare better? And then you convert that to actions. So, for example, reaching out to a advocacy group, joining an advocacy group, reaching out to your healthcare providers, reaching out to healthcare systems, and then you use the resources that are available around you so that you are able to advocate for yourself. So I'm going to break down each of those three. What are the thoughts and cognitions? Accepting that cancer is a part of their life. Usually when a diagnosis of cancer is given, there is denial. People do not accept that they have been diagnosed with cancer. There is a lot of self-doubt. Sometimes there is shock. And during that period, the patient is unable to take any part of, decision making. So they become passive recipients. Instead of that, if you are able to accept that there is cancer and that it is going to stay with you and you have to manage it, you then become an active participant in your journey with cancer, and you're able to prioritize your needs and wants throughout the cancer continuum. Depending upon what the journey of that cancer would be and how it would progress, you would be able to anticipate what you would need as the cancer moves forward, and you're able to then adjust your life around those needs. This leads to a sense of empowerment because you're more in control. You know what to expect when and how to overcome whatever demands are there. So what this leads to is action. So you take command of the care through assertion. So you decide whether you want to go through chemotherapy or radiotherapy or surgery or a combination of these three. You ask for choices for treatment, whether you should go through the traditional method or you should look for advanced care, whether other options for treatment are available, whether your financial status helps you to choose those better options. If your financial status is not allowing you, what could be some of the ways and methods to raise the finances to be able to go for optimal treatment options? Are there government schemes that can help you? Are there pharmaceutical programs that can help you? So all this, you start to look for those answers and take command of your care. And then you see yourself as members of the healthcare team. So you have an active participation with your oncologist, with your palliative care physician, with your nurse, with your infusion specialist, with your physiotherapist, with your pain management person. And you speak with them and you try and learn as to what they have in mind for your care journey, and you participate in that. And then you make informed decisions about whether to adhere or to modify the treatment. And once you have managed to control your cancer care journey, you also start to look for resources. You look for individual or group supports for cancer care. You identify with a larger cancer community. And then once you are cancer free or you have your cancer under control, you start to contribute to cancer awareness, policy, advocacy, research, etc. What are some of the other factors for self-advocacy? Not everyone can be an advocate. To be an advocate, you need to have communication skills, you need to have personal characteristics and commitment, you need to be able to go beyond self and have this want to be able to help others. You should be able to have curiosity to answer questions and courage to answer questions. You should be able to absorb and digest the information that is being given to you, and to be able to use that information to help others who are looking for that kind of information, as well as use that information in your advocacy efforts. You should also have learned skills, for example, typing, researching, looking into papers and reading and analyzing. A lot of soft skills are required to become a patient advocate. And then you should be able to offer support to others and be able to support yourself in the process. Being an advocate needs a lot of time commitment and resource, as well as personal skills. And um, one has to commit to be a patient advocate. So what kind of personal characteristics the impact the ability to become a patient advocate? One, because you're already having a condition, you should be able to successfully manage those symptoms so that you are symptom free and in a reasonably good health to be able to advocate. You should be able to make role adjustments. So if you're suffering from cancer or managing cancer, are in a full-time job and still want to be a patient advocate, it would need some role adjustments so that you are able to give time to become a patient advocate. And most importantly, for cancer, sometimes some cancers are very aggressive and you may not be cancer free in spite of the best treatments available. You need to plan for palliative care and for end of life. Some of the learned skills, as I mentioned earlier, are communication skills, ability to navigate the healthcare system. And in the context of India, healthcare systems are usually very diverse, but we have two healthcare systems, the public healthcare system and the private healthcare system. The public healthcare system is complex and depends on whether it's a very large facility like the All India Institute of Medical Sciences or a primary care center. And one needs to go to that center and understand how it works, who are the influential people there, who do you need to talk to be able to understand how the system works, what is the chain of command, etc. And in the private healthcare system, each hospital has its own method. Nowadays, digital tools are available to be able to contact people within the private hospitals to ask questions. There are chatbots, there are WhatsApp groups, etc. And one needs to research all this to be able to understand what will work best for the condition that you have. To be able to make informed decision making, have problem solving skills, and information seeking skills. For attainability of support, you one should look at family and friends who can help in your care journey, especially for transport needs, for emergency response needs, etc. So one should have numbers from family and friends that can help you when you need support. And you could also reach out to support groups and support organizations who could connect you with the right care providers or hospitals in times of emergency or for general care needs, etc. So how does one assess a patient's ability to self-advocate? This is a short questionnaire. So that does the patient accept cancer as part of their life? Do they feel empowered or do they feel defeated? Do they feel that everything has come to an end and that they are going to die? Or do they have hope in their life? Is the patient assertive and engaged in shared decision making? Are they able to communicate? Are they shy? Or are they able to come out and talk in a group? Does the patient use available resources? Are they able to research the web? Are they able to look at various resources and make informed choices? Let us be honest, on the web, there is a lot of information, but not all information is genuine. So is the patient able to discern whether the information that is available on the web or on various printed pamphlets, etc., is genuine, and are they able to decipher that genuine resource and convert that into action? Does the patient have personal characteristics to help them advocate? Does the patient have skills needed? So are they able to type a letter? Are they able to use simple, say, tools on the internet? Are they able to use a laptop or a smartphone? All these are characteristics that are required. Does the patient have access to support? So are they able to reach out to family, caregivers, support groups, hospital networks, etc., to be able to communicate their needs? What are some of the barriers to self-advocacy? One is, of course, the fragmented healthcare system. And we all know that usually in large hospitals, it's very difficult to navigate the system. There are several departments, and each department has its own method of communicating. Some advanced hospitals communicate through email. Not all patients will have an email access. Some hospitals give you a printed report, and you need to carry that printed report every time you visit a doctor. And if there are various specialties that are managing your condition, not all specialties might be speaking to each other, and communicating to every specialist and talking about all this doctor prescriptions, etc., might be difficult. Need to support patient empowerment to advocate for themselves. So how do we do this in fragmented healthcare systems is through support groups. They can be the ones who identify the gaps in the system and are able to talk to policymakers to manage those gaps. Then also overwhelming amount of information. As I said before, the web is full of information, and one needs to decide what information and what resources should be used. Not all resources and all information is useful, and sometimes not authentic as well. So one needs to be able to identify the authentic sources of information and use it to advantage. And you need to know how to incorporate that information into conversations with healthcare providers, what kind of questions to ask, and how to use the information that you have received from the authentic sources to be able to create a care pathway that is best for you. How can one support patient empowerment? Through providing knowledge, providing information and resources. So this is when once you become a patient advocate, if you wish to help others become empowered and start their journey of patient advocacy, what would you do? So you would provide information and resources that are useful. You would discuss options. You would help with decision making. You would encourage assertiveness, and you would be able to inculcate skills that empower them for their ability to self-care, ability to cope, and ability to actively communicate with their healthcare providers and others in the ecosystem. What do you need to do to be able to help others become a patient advocate? So you have to first learn about them. What are their main issues? What are their barriers and problems? What are their strengths and weaknesses? What is their personal history? What kind of cultures they come from? What kind of belief systems they have? And what kind of support systems they have? So, for example, going back to a cancer patient, suppose this cancer patient comes from a vulnerable group, and this vulnerable group has a cultural barrier that a woman patient cannot be examined by a male doctor, for example, or they believe that their religion, sort of gives them the ability to eat particular type of foods, and they are not allowed to have any other food. Then even if you tell them that your medication has to be taken with, say, eggs to give them protein, and they are vegetarians, then they will not take the eggs. So you have to provide them vegetable options for proteins. So it is extremely important that when you're helping others in your group to become advocates, you have to learn about their beliefs, about their culture, about their personal history, about their families, what kind of support systems they have, whether their own communities provide them support for these kind of issues, whether there is stigma within their communities about cancer, which will then make them adverse to discussing their problems or not talking about cancer at all within their communities. And after you learn about all of these, look for solutions and what kind of personal goals the patient has, whether they wish to be cancer free, just manage their condition to the best of their ability, live a productive life, or just manage their signs and symptoms and feel better. One of the most important things that I talk about when we talk of patient advocacy is most of our educational material is in English. And when we speak with patients and patient groups, people have limited English proficiency. So it is important that you find language that is understood by them, and provide the services, provide information, and provide support in a language that is native to them and it is easy for them to understand. Consider minority serving organizations, look for support groups that provide local language support, give patients direct extension or contact information of bilingual staff, work with interpreter services if available. If you are a bilingual expert, provide additional support by talking to the healthcare provider in English and translating it to the local language to the patient. Enlist family members, friends, and neighbors to make calls in English and provide other support if the patient is unable to navigate in local language. Practice asking for a person who speaks the language of the patient and identify agencies that the patient can visit in person. Self-advocacy tools to support patient, a checklist of questions to ask providers, checklist of items and documents to take to appointments, list of local resources, for example, support groups, financial and legal counsel, other support groups, etc., and information packets that could provide information on medication, on support programs, on livelihood options, on educational materials, etc. How can one support patients? You can draw from knowledge of medical terms, remain empathetic, encouraging, positive, and reassuring. Focus on working with the patient, gently confront the patient when necessary, and encourage the patient to speak up and ask questions and to make sure she or he understands all the treatment options. One of the most important thing is to maintain communication with the patient. Do not ever promise or guarantee anything that you cannot definitely provide yourself. Always keep your word and follow through. Do not make empty promises. Be open and honest with the patient about realistic outcomes and keep the patient updated. Moving on to system advocacy. Once you are a patient advocate and you are empowered enough, you have the knowledge and the tools, speak up at tumor boards if you are invited to them, talk with doctors about common issues you see, convene meetings if possible, join committees and work groups, contact local organizations, call state or national representatives, and speak up and provide information that you collect from your patient groups. No. No. Thank you so much. That's the end of my presentation.
Thank you, Dr. Ratna. That was really very comprehensive. I all of the questions that I had sort of jotted down got answered on the way. So maybe I will move to the comment section. So we have a lot of people agreeing with you on the presentation points that you shared with us. And someone said, being a cancer patient advocate isn't easy. It requires holistic approach from communication skills to empowerment skills, taking the extreme nature of disease. And perhaps I can ask you, maybe we can go a bit into a segue from this point and ask ourselves this question: why is it that most patient advocates complain about this one thing, that they have a full-time job that they have to rely on for monetary support, day-to-day support, and then do patient advocacy as a passion project? And you obviously are a living proof of who is an exception to this point. So what is it that has helped you transition your passion into your career, and what advice can you give the panelists here?
Okay, that's a very, very difficult question because in the context of India, there is no institutional mechanism to support patient groups. So we do not have any government funding that supports patient groups. And the sustainability aspect of patients most often is from pharma companies that provide projects and other opportunities. However, and also patient groups usually start with an altruistic mind. So they think it's charity and do not monetize their skills. So my advice would be that once you become an expert, you should monetize yourself and do not do everything for free. Wherever possible, be an expert and monetize it so that you are able to make some kind of living out of it. And the second is, once you join a patient advocacy group or you create your own patient advocacy group, run it like a business institution instead of an altruistic mission. So yes, we are out to help people, but in the process, we should also be able to generate enough funding to be able to have at least some core staff. Not everyone can be funded, but there are ways and means of writing projects so that you are able to generate funding to support core staff that can then keep your mission running. Otherwise, simple volunteerism can work up to a certain extent, but it is not sustainable.
Thank you, Dr. Ratna. So you mentioned how the first step to actually monetizing this skill of patient advocacy is to, understand the worth of your advocacy efforts and then monetize based on that. So if you are an expert at something, if you are a subject matter expert, so you need to monetize it. But often this expert word comes in, the more people put themselves out there. But then the people get invited when they have the experience. So it is sort of a loop, right? So how does one even get into it? You have talked quite extensively about, reading up resources and understanding the subject matter and everything, but not everything can be inculcated by just studying. Some things you need to understand by just going out there. So for someone of my age, I am in the public health spectrum enough to understand things about it, but I'm also someone who struggles with maybe an imposter syndrome because I don't consider myself to be an expert. So there are quite a few people like this out there. Maybe Nomika can resonate with me on this. So what advice can you give us? That would be great.
So I would say you have to start somewhere. There are a lot of resources and opportunities out there. One has to keep their eyes and ears open and participate as much as possible. Possibly in the beginning, it might not be monetized, but once you start going to these forums and speaking up, you will be recognized. And once you are recognized and you are giving meaningful inputs, you will be invited. Once you're invited and you speak at large public forums or webinars or even small webinars, but by organizations of repute, like say, for example, the World Health Organization or other such large entities, people will look up to you because there is sort of confirmation that if you have reached to that level, then there is possibly something of value that you can provide to people of similar conditions or the audience that are participating in such events. And then what happens is it's like a spiraling effect. Once you reach that level, people start to reach out to you. You have to write opinion articles. Yeah, there are various means and methods, but you have to keep going at it till you reach that level where you are recognized as an expert.
Thank you, Dr. Ratna. Nomika, please feel free to give your inputs on this. I have allowed you to
Hi,
mute
am I
yourself. Yeah.
audible?
Yes,
Uh,
you are audible. Go
yes.
ahead.
Yeah, so first of all, so beautiful views here. And second of all, there are a very few patient advocates in India right now, especially just basically in metropolitan areas. But what about making other patient advocates? For example, if I'm a patient advocate in NCD, and I want to make somebody else a patient advocate who is having a very beautiful potential. What do you suggest? Because the main area lies that, we need to have many patient advocates in rural areas of India where many diseases are considered stigma, be it cancer, be it cervical cancer, anything. It's not until you go to the metropolitan India or you go to counseling, psychotherapy that you basically get to know that these the, all of these diseases are actually accompanied by some form of distress and you need to make out of it instead of considering them a stigma. So please answer my question.
Yeah, yeah, I completely agree. And there has to be representation from rural India. But let me also sort of substantiate this with one of the projects in which we work for hypertension awareness in rural India. And the person who actually spoke to a policymakers forum and an MP forum was an ASHA worker from one of the villages. And she became an advocate because her father-in-law had suffered stroke. And she, being from the healthcare system, had faced challenges in accessing services for her father-in-law. We worked with many such people from villages and rural areas to be able to uh, build their skills to speak at such forums and bring together the challenges that are there in the systems and how do we then reach to the policymakers. So it's a journey. Not every person from a village or a rural area can become an advocate. And groups that are there in metropolitan cities and other big cities who are already doing some advocacy need to reach out to these people from rural areas and connect with them so that they are included into the conversation and give them a platform where they can come forward and speak their views. So I can have, sort of cite several examples, whether it is cancer, whether it is HIV, whether it is tuberculosis. You have several rural patients who have become very vocal advocates who come forward and speak at forums and share their views with policymakers, with members of parliament, etc. However, it's a process. And there has to be a two-way communication. People who are working in cities have to reach out to rural communities. Rural communities have to learn how to search for people who are working in urban areas and connect with them. Now, with social media and with digital tools, it is not so difficult. And that you can actually have campaigns where you can reach out to people from rural areas and from tier 2 and tier 3 cities and be able to include them into your patient group so that they are able to contribute from the perspective of challenges faced in rural India as opposed to the problems that people in urban India face in metropolitan cities.
Right, thank you, Dr. Ratna. Maybe shifting from the rural India to a global level now. For the past 60 days, you have participated in a lot of moderation and speaker, positions, a lot of them. How would you place India on a spectrum when it comes to advocacy efforts that we've done? And I say this, sort of building upon our International Patient Summit as well, where we saw quite a few advocates, very energetic advocates. But how do you think we're doing in the global context?
I think we are doing fairly well in terms of people becoming patient advocates. And a lot of patient groups are there. Just the Indian Alliance of Patient Groups, about 80, 90 patients groups are there. And if I break down just in cancer, we have about over 100 patient groups working locally, at state level, at national level, etc. We have about 30, 40 patient groups working in rare diseases, an equal number working in communicable diseases and like TB, HIV, Hep C, etc. We have a lot of patient groups working in neurological disorders like epilepsy, stroke, multiple sclerosis, several very strong, very old patient groups working together. However, in the context of India, we do not have a national representative body of all these patient groups, and we do not have an institutional mechanism to support the national representative body. Therefore, within the context of the country, patient advocacy is very fragmented. Each group is advocating for its own cause. There is no common cause that all of them together are working towards at the national level, and that sometimes can be difficult and challenging because each one has their own priority. And when you go to the national level with several priorities, then certain priorities are taken up and certain priorities are lost in the dialogue. In terms of representation of patient advocates at the global level, we have several patient advocates doing extremely well, representing in bodies like WHO, UN, etc. And India has contributed to president's positions, CEO positions, chair positions on advisory boards and global boards, etc. So we are doing pretty well. However, our internal environment needs to be strengthened so that unified patient advocacy becomes a reality in the future.
Absolutely, that's great to know that we're doing well. Maybe it's it's helpful that we are able to flex in front of someone like Arijit, who comes from a country where there's so much support when it comes to building patient organizations and in general advocacy initiatives. They have a very structured system. So good to know that we are not falling behind. Okay, so just for the last question, you talked extensively about why it's a bit difficult to move forward with advocacy within the context of India because um, the goals sort of fall apart after a time, and with the current population, it's very difficult to align everyone towards the same goal. And I say this because we recently had a poll asking people what is it that they desired the most out of a support group, and the answers were completely divided. Half of them talked about wanting credible resources, while the others wanted a safe space where they could just share about day-to-day things. And in my personal experience of having moderated support groups as well, I see some people being very happy that they can share their day-to-day problems amongst people like themselves, while other people being frustrated that they don't have access to, a list of doctors or, credible information, and they feel frustrated that people are sharing too much. So in situations like this, like how would one, a person who has newly created a group navigate through something like this?
I would say all of those goals are important, and which is why I said patient advocacy is a very personal issue. And for the goals that are important to me might not be important to others. But the trick is to find the common space. What is it that everyone will agree to? And every patient has a different point in their journey. So someone might have reached the treatment level where they are just on maintenance, and someone might have been just diagnosed. So the level of information that each one is looking for is very, very different. However, what might unite such a group is maybe, a new treatment or a new research. Or information that's not available in this country, or medication that's not available in this country and needs to be brought here. That would unite the group. So one needs to look for that unifying factor and build on that while all other conversations happen in the background, because that will then keep the group united, and it'll be something that nobody knows or has little information about, and is you know picking their curiosity so that they are looking forward to more information that is being shared in that particular group.
Okay, Dr. Ratna. With this, I would like to close this discussion and sort of circle back to the point that Dr. Ratna made earlier on. Advocacy efforts, as philanthropic as they may be, at the end of the day, if you want it to be sustainable, you need to think of it a bit from a business perspective. Might sound very shrewd, but it's the reality of the system. If you can't change the system, then we have to sort of, uh, sail with it. So, with that, thank you so much, Dr. Ratna. Thank you, Nomika, and thank you everyone else who joined this discussion. And I hope you all have a great day ahead.
Thank you. Enjoyed it. Thank you.